Good evening. Thanks for joining us. We begin tonight with the latest strategy to tackle what critics say is a healthcare system that is not working. Surrey Memorial Hospital is about to use a nearby motel for some of its patients. It's never been done before in BC. CTV's Michelle Bernoro on how it will work and why critics call it a Band-Aid solution.
It's busy at the George Point Inn in Surrey, not getting ready for tourists needing accommodation, but for Surrey Memorial patients who are ready to be discharged but can't go home for a variety of reasons.
Having patients in an acute bed when they are ready for discharge is not good for anybody, and certainly not for the patients.
The entire motel is being leased by Fraser Health and turned into transitional housing.
We have staffed it with 24/7 nursing staff because maybe some of these patients, even if they had gone home, would have required some help with taking their medications, for example.
There will also be mental health support and social services. The doors will open to a handful of discharged patients on Monday, and gradually the number will increase to about 50.
But we're not creating a hospital here. None of these are hospital beds. It's to improve the care and the supports people get when they return to the community.
Officials say while the idea of patient hotels for those being discharged from hospital is something new here in BC, it is not unique in other parts of the world, specifically Northern Europe, where they say the concept's been used since the 90s.
The research from Europe actually shows that there are positive outcomes for the patients.
Surrey Memorial has long been plagued with overcrowding. Vandenberg says the transition beds won't alleviate congestion, but will shift the dial in the right direction.
It means that those patients in the emergency department who are the sickest in our hospital, they get into acute care bed faster.
Surrey Memorial's emerge sees up to 600 patients a day. Portables were recently moved onto the hospital site to create a temporary pediatric emergency waiting room. Meanwhile, the Surrey councillor says the changes are a sign of a bigger problem.
This is just a Band-Aid solution to an overall problem that we have with the number of hospital beds here in Surrey. We have over 600,000 people living here, and we're shy of 800 beds here.
Fraser Health will spend $4.5 million to lease the motel for 2 years and another $5.5 million on operational costs for the pilot project. Michelle Bernoro, CTV News, Surrey.